Good evening, everybody. Welcome to Team Training Tuesday. And today we want to try and demystify the burden of uterine fibroids. I've chosen this topic, and I know it has also been requested by several people because it is a very common problem. And it is also one of those things that we have been wondering, why even do they happen? So I've called it the burden of uterine fibroids. And as we go along with the presentation, you'll understand why perhaps I've called it the burden of uterine fibroids. My name is Dr. Eseza Nambassi. My brand is Simply Healthier. That is my brand. It is that we should try our level best to stop outsourcing our health. And that is why I call this session Applied Neolife, because we have an opportunity called Neolife. It's actually a family of people who have chosen to take the health and wellness route using products that are supplied to us by an awesome company called Neolife, which has been in existence for a mission, shifting focus from sickness to wellness. And it can be done by becoming more intentional about getting information and knowledge, and then applying what you have learned. And when all is said and done, eventually you'll find that lifestyle changes are the way to go. Right, so what are fibroids? Fibroids are defined as benign, smooth muscle tumors in the uterus. Benign simply means they are not cancerous, so they are not malignancies. They can be also called leiomyoma or simply myoma. And you know, funny enough, they are thought to be triggered and their growth stimulated by hormones, specifically estrogen and progesterone. And many of you who have attended previous trainings have heard me say that estrogen promotes growth. And we girls have a lot of estrogen, which fluctuates depending on what is happening in our body. Estrogen levels rise quite significantly during pregnancy, but throughout we have quite a lot of estrogen, as do men as well. So that is just a picture to show what they look like and their position. And as the presentation goes on, you'll understand why I've put up this picture, that intramural in the muscle. They can be under the lining of the uterus. We call that submucosal, or they can be under the lining, the outer lining of the uterus, and that's what we call subserous. So position is crucial, as we'll see. Now, what are the associated risk factors? Risk factors, age. The environment, isn't that interesting? Stress, isn't that interesting? The diet. Okay, now we're getting closer and closer to things that we can perhaps modify just by knowing what to do. Vitamin D deficiency, that has been associated with fibroids. And then the reproductive history and ethnicity, which might suggest that they might be a genetic component, but ethnicity, and we'll unpack that as we go along. Now, who are affected? It is estimated that 70 to 80% of women have fibroids by the age of 50. That is astounding. The fibroids are also most commonly found in women in their reproductive years, in their 30s and 40s. Now, This is a factor more common in Black women. 25% of Black women will have fibroids by the age of 30, as compared to only 6 or 7% among the Asians and the Caucasians. Now let's look at symptoms. Symptoms that might point or may point to fibroids: abnormal uterine bleeding and maybe even irregular periods. And then there's what we call bulk symptoms, where one feels pressure, pelvic pressure, or bloating, or even urinary symptoms, having frequency and recurrent infections, constipation. In other words, there's almost as if there's a lot of weight and bulk in the pelvis. And you need to appreciate the pelvis is a relatively small space. And in there has to be the rectum, the uterus, the urinary bladder, and the ovaries. And then, of course, the surrounding tissues. And so if there is, in addition to that, a uterus that has fibroids, that would create that sensation of bulk. And then pain, nondescript pain that one cannot quite put a finger to. So this is a quote that I found, somebody who's describing her periods. It got to the point where I was throwing up and couldn't eat anything all day. This is somebody who was describing it. And for the girls on the call, many of you, when it comes to your monthly period, might go through a torrid time. I speak from experience. I remember when I was at high school, it was a hard time. I couldn't wait for that time to come to an end. So making a diagnosis, diagnosing fibroids, this is what needs to happen. And those of us who went to school in the good old days were taught to take a good history, okay? And obviously that is facilitated when there is a good rapport between the doctor and the patient. However, the experience often is that there is a long queue and the doctor is in a hurry and there's absolutely no time to take a good history. So again, I speak from experience where if I'm given enough time to speak to my patients, I will. And so that is part of the reason that I'm doing this more and more, because this is about building relationships, okay? Then the next thing is a physical assessment of the patient, including a pelvic assessment. Now, many people don't have time for that. And many patients won't even tell their doctor that that's where the problem is. But after taking a good history and a physical assessment, then the lab and any imaging that follows are to confirm what one is already suspecting. So in the lab results, one might find anemia, which should have been seen on physical examination if the doctor is doing their work well. And then imaging is again to confirm what one can perhaps one could have felt during a physical assessment of that patient. So diagnosing fibroids is not always easy. And a lot of people might look a bit like this these days. And so let's just carry on. Fibroids are notorious for creating this unfortunate situation called infertility. So let's talk a little bit about infertility and fibroids. They may be the only reason for infertility percentage of cases with fibroids. To find that only the fibroids are causing infertility, there are usually other things going on. For example, fibroids are notorious for creating the environment for infection, for pelvic infections. Okay, so it could be the result of those infections that result in infertility. Now, depending on where the fibroids are situated, there could be distortion of the uterine cavity, and that may lead to higher rates of miscarriages. And miscarriages are a form or one of the manifestations of infertility, if one can considered as infertility. So this might even reduce in the event of in vitro fertilization, that is fertilization of the ovum and then introducing it into the uterus afterwards. Plantation rates. So they are pretty serious. So just to recap how fibroids affect fertility, they distort the uterine cavity. They impact the uterine lining and therefore implantation. They decrease blood flow, as you can well imagine. Once they are present, they will decrease the flow of blood that should go to the lining of the uterus. And then they may actually block the fallopian tubes. So this is a visual of multiple fibroids, and if they are situated where the connects to the uterine cavity, they could potentially cause blockage there. Okay, let's just go on. I found this interesting fact. Look how heavy that fibroid was. The largest fibroid ever removed weighed 70 pounds. That is approximately 36 or so kilograms. Massive. And yeah, this is actually a very sensitive topic because our late mother had huge fibroids removed from her. I just couldn't believe how big they were. But she was, she had all of us. And yeah, that actually was quite astounding. Now, reasons for late diagnosis. And this can be something that we all need to be aware of, and that's why I'm having this team training so that we become aware. One of the top reasons is that there might not be any symptoms. Crazy. Another one is lack of awareness by the patient, resulting in accepting symptoms as they occur as being her normal. And so says, oh, well, that's how I am. I always get horrible periods and I bleed a lot. And so that is one of the things that you need to be aware of, that fibroids might have no symptoms, and therefore it will be a reason for not knowing that they're there. Okay, so lack of awareness of the patient. And then the other one is complexity of that part of the body, the pelvis. As we pointed out, few patients will readily accept an assessment, and few doctors have time to even consider a full physical examination, including a pelvic assessment. So the result of that is that in a survey, and I want you to think about this, in a survey of 1,000 women, it was found that the average time to seek treatment was about 3.5, imagine that. And then in 32% of those women, it was actually over 5 years. And that could have been because of the possible infertility that they were now frustrated with. And then 42% of those women had seen 2 or more healthcare providers. I hope by discussing it today, we can become wiser and help our friends who might have the challenge. So now let's look at the impact of fibroids, specifically on African women who we have seen have them more commonly. They happen to affect younger active women. And the impact on that is that school and work are affected, anxiety about heavy bleeds, effects of chronic fatigue due to anemia, low self-esteem due to poor performance, and on and on. And if it is a job, for example, which is performance driven, and the men are not sympathetic, basically because the woman might not be able to verbalize her symptoms and how she's feeling, that can set up this poor young active woman to a lifetime of misery, as we can well imagine and empathize. And then also, they seem to have more symptoms. They seem to have more symptoms because their fibroids tend to have to be larger. They tend to be more numerous. And if diagnosed and operation is suggested, this can be very, very stressful. Imagine the financial implications, and of course, the lack of resources to perform the best surgery, such as minimally invasive surgery, surgical procedures, which do exist in person. So I hope we can all look at this. As I was reading around it, I was saying, oh my gosh, we really need to be super sympathetic, and we need to be able to share what we've got in the way of prevention, which we are going to discuss later on. And particularly our young girls that are still growing, we need to become stricter as mothers. I know there is a reason to all this, and we'll unpack it as we go along. So, lifestyle factors. And I've simply put it as learning to control the controllables. So here goes. The role of diet. Is it important to take a closer look at diet as a root cause? And as you think about that, can we influence the burden of fibroids? I truly believe we can. I really truly believe we can, as long as we are prepared to also change the way we think and have a major mind shift on a lot of things. This picture is to show you that by changing the diet, yes, a lot can happen. Question, does food really matter? And studies show that too much meat in the diet is associated with an increased risk of fibroids, particularly pork and commercially reared beef. Now, think carefully, what are we feeding our little children? Yeah, we like to pack sandwiches or lunch boxes, and we go and buy all those processed meats, which might not be good for them. And we are setting up little girls to later develop this challenge, among other challenges. So a plant-based diet can be protective, that is from studies. So right there in the middle, you can see all those beautiful cruciferous vegetables. Carrots have plenty of carotenoids, and again, plant-based. So I just got all the beautiful pictures to rub it in. But then let's look at the role of vitamin D. That was on the risk factor list as well, deficiency of vitamin D. A study showed that women with fibroids were found to have lower levels of vitamin D compared to controls. In other words, women without fibroids. So they took, that study was quite specific just to find out. And also, people with darker skins are up to 10 times more likely to have low vitamin D levels. You have heard me say that in the past on a previous presentation. So we can conclude, and would be quite right to conclude, that vitamin D deficiency may stimulate fibroids. I hope that hormones and hormonal health and weight management. There are 7 keys to remember, and those are they. Exercise regularly. It has been shown that regular exercise helps to prevent fibroids. And unfortunately, modern lifestyle is such that we are not exercising anymore. It also helps to manage weight. And then, of course, adequate and nutritious food. We've talked about that, as long as it is plant-based, heavily so. And then getting sunshine. That will trigger your skin to make vitamin D, as long as the raw materials are in that skin to enable that, which I'm going to talk about as we go along. And then remember to switch off electronics close to bedtime. That the reason for that is to stop messing up the hormones. And we have said that there's a hormonal component to the vexing, bringing down stress. If you remember the list, stress was among them. And stress also messes up hormones big time. Get enough sleep, again, for your hormonal health. And ditch toxic chemicals around your house and wherever they are. So as regards managing stress, a lot of people know the need to exercise, and that is very good. But unfortunately, if all other things are out of balance, they might be doing the wrong type of exercises that are very, very stressful, and that could trigger stress, other imbalances, including hormonal imbalances and fibroids. So why it is important to maintain healthy weight. Now, this is very, very important. And I know many of us are so aware that we should be doing something about our weight, but it becomes difficult. And I totally sympathize. It's not easy. It's easier said than done. So obesity is associated with greatly elevated levels of estrogen. That's a fact. And we have already seen that estrogens are some of the fuel for growing fibroids. Weight gain of more than 10 kilos so that your BMI becomes higher is associated with increased risk of fibroids. Now, you know, culturally, among us here on the Africa continent, we almost laugh at somebody who tries very hard to manage their weight. We point at them and say, what's wrong with you, girl? Don't you know that we need to see you fat in order to know that you are well and healthy and all that? I think we need to change our way of thinking on that one. So here we are going to discuss a few solutions, but before I do, we did say that fibroids might lead to infertility, but no, not in everybody. Fibroids and pregnancy happen. And fibroids, because of the increases in levels of estrogens and the hormones, may increase quite remarkably in size during pregnancy, but then they will subsequently go back to a smaller size. However, in 10 to 40% of people, it has been studied that they can cause the following complications in pregnancy: pain, preterm labor, what we call malpresentation. In other words, where the baby, because of the presence of the fibroid, presents not in the normal way. The space in the uterus is taken up by the fibroid, so they might actually be unable to rotate and present with their head first, and might come down with their feet first. And then placental complications. That includes let's say there's a huge fibroid up at the top of the fundus of the uterus, right up at the top. And that is usually where the placenta is supposed to start developing and take residence during the duration of pregnancy. But if there is a fibroid, there will be lower blood supply there. And so the placenta will migrate down, down, down to cause a situation that we know as placenta previa. Placenta previa, and that is one of the a drastic placental complication, because later when it comes to delivery, it is right there in the way, and that can result in all sorts of trouble. And then cesarean words after delivery, a lot of bleeding can happen. Postpartum hemorrhage is bleeding after delivery. So those are the fibroids and pregnancy. But I always like to go back to the basics. And if we can remember the role of inflammation that can be as a result of a multitude of things in our lifestyle, including the diet, or the chemicals, or the stress, or the way we have chosen to live our lives, or even if it isn't by choice, but because we don't know, then this is the reason we like to discuss in these sessions. And so now let's look at some possible solutions to our problem. We belong to a company called Neolife, and we always are ready to welcome people who would like to join the family, the Neolife family. I would like to talk specifically to women that, ladies, it is up to us to make good choices for our families. It is really up to us. And I recommend that you, after this presentation, if you are a guest, turn to the person that invited you and hear more about how you can become involved in Neolife. So let's start at the beginning. We have, okay, mute, kindly mute. Okay, we have cleaning products. Okay, let's mute whoever is talking. Okay. We have cleaning products that are highly economical, but most importantly, they're non-toxic. And if you know the value of avoiding toxins as a reason to avoid inflammation, that's where you would all start. And if you have loved ones who haven't yet heard that they can change their cleaning products and therefore change their health status, including the status of their little girls that will one day grow up into adults, then this is where to begin. So we have those ones, very, very economical. And then we have laundry compound. Now, last week we talked about the men, and we talked about the prostate, and we said, ladies, again, we have the power to ensure that we use for our washing a product that is guaranteed not to be hormone disrupting. It will not increase the estrogen levels and therefore cause all sorts of trouble. So I suggest that we consider these cleaning products as a basic minimum. You will save a lot of money, but more importantly, you will also be able to look at other products, such as what I'm going to show you. Now we have what we call our core products, and among them, that's a Shake and Pro Vitality, but I want to focus specifically on the fish oil, which is a big, big deficiency in our diet. That is called omega-3 salmon oil plus. It is important in cellular function. It will reduce inflammation in blood vessels, joints, and in the muscles. And I am so convinced that it is inflammation in all tissue, including the uterus, which is a muscle, that fibroids begin to happen. It's almost like a response to inflammation. Omega-3 will also give you the building blocks to build a lot of anti-inflammatory agents. And so by having it on board, you bring that response to an end, the unhealthy type of inflammation. And our difference is that it is totally complete. It will give you all the 8 molecules of omega-3, and that way, even the uterus and the joints and the heart and the brain are protected. And so it will evict, or it will displace, the pro-inflammatory oils. And so I've chosen it today as the star product to consider as a good place to start when supplementing. And to give it to even the little children, we have the big capsule and the mini for the little one. As we continue with our core nutrition, remember that all the 22 amino acids are what build healthy muscle. The uterus is one of those muscles. And if you look at it that way, you'll understand why Neolife has this as the core nutrition. But let's go a little further. You might remember that I said obesity or weight gain is one of the things that causes fibroids to thrive. Neolife Shake is amazing in that it helps with glycemic response. In other words, the blood sugar, so that the effect of high blood sugar, a nutrition supplement, and it will also bring down inflammation and control your weight. So it's a win-win all the way. So I emphasize maintaining muscle mass. Remember, the uterus is a muscle. You need to maintain it, and healthily so. So we have those amino acids. So let us look at other products. I mentioned vitamin D. We have chelated CalMag, which contains vitamin D. Very, very important. We have magnesium, which can help with the pain that happens during this monthly cycles. Oh, sorry, I've gone too fast. Let's go. We have Cruciferous Plus, and I'm just picking out the salient points. Cruciferous vegetables, you saw them in those delicious looking pictures of the plant foods that detoxification systems, and also promote a stable, healthy estrogen balance. That's what we want. So this is out of nutrients. And then we have feminine herbal, very, very important, but it will also influence your central hormonal system. It will regularize your cycle. It will help with fertility, should there be an issue of infertility as a result of fibroids. It will help with all the bloat situation that fibroids cause. So there you are, feminine herbal complex. Apart from that, the emotional side of things, we've said that anxiety and low self-esteem are part and parcel of somebody who knows that they have issues with fibroids, and feminine herbal can be used for that. So I think that comes to the end of our presentation. I want to stop the share and see all of you and invite any discussions, any questions, and also to thank you all for being here.